Hey, good morning, everybody. Amir here, pharmacist at Butterfields, and I got such an amazing treat for you today. In the house, we have Dr. Pamela Smith, best-selling author of 14 books on hormone replacement and maximizing health. Just an amazing teacher and mentor to me over the years. And we're going to answer some of your questions that you guys have called in over the phone, that you've sent in to me over the past few months. So, Dr. Smith, thank you for being here.
Oh, a pleasure to be here, truly.
Awesome. Well, let's get into men's health a little bit. More than ever, we're starting to see men in their 30s and 40s and 50s come in with clinically low testosterone. And in addition to that, they're having symptoms, weight gain, muscle loss, memory fog, low libido, right? And doctors are recommending that they start a testosterone regimen, right? But they're hesitant, right? They say, well, I have to be on it forever. Do I want to start it? Do I not want to start it? What are some of the benefits that you've seen clinically for the men that do take that decision, or that leap rather, to start testosterone therapy?
Now, testosterone is really important, and it does decline with age. And so some of the key components of testosterone for men, of course, it's sexual interest, which is probably why most men want to look at it to begin with. But it gives you energy, it builds muscle mass, and it lowers cholesterol, blood sugar, blood pressure, and literally helps maintain memory. So those are the things people get concerned with aging. It's about vision, memory, and mobility.
Absolutely.
And I can't believe it, but honestly, I will be in a couple of months 70.
Oh, stop it.
Which is now, honestly, it's really, really young. And the same thing with men. When we look at hormone replacement for them, because it does maintain vision, memory, and mobility, it keeps them younger.
Absolutely.
So that literally they're able to get about. My husband and I were on a cruise last year down the line, and my husband was so funny.
Mm-hmm.
He looked at me and he said, honey, aren't most of these people your age? And I said, yeah, probably within 5 years they're our age. And he goes, but they're old.
Mm-hmm.
And I said, well, dear, you're on hormones, I'm on hormones, they're not on hormones. Because we could run around, and we went up and down the hills, and we went biking and everything else, and they couldn't do a lot of those activities, but much of that has to do with hormones.
Absolutely. Well, let's speak a little bit to those men who are still in that age range where they may have children, right? So they've been getting recommendations from the doctor to do clomiphene or enclomiphene. Do you have any experience with that clinically, and what is your recommendation?
Absolutely. In fact, the best way for a younger man to actually build testosterone is exercise.
Absolutely.
So first of all, we try and get them exercising, and probably a fourth of men don't need to do anything else. They just need to start a really good exercise program and do it 4 days a week, and their testosterone when they're younger will automatically go up.
Absolutely.
Some men have an issue with weight, and their testosterone goes down because as they gain weight, estrogen goes up. And so it changes the binding of the hormones. And because of that, if we can get them to lose weight, then that is also wonderful. There's different nutrients that help make testosterone, like zinc. And so having people be nutritionally sound. And do I use clomiphene in my practice? Absolutely. I really try not to give testosterone to men under the age of 42, because you never really know if you're going to have children. And this happened to one of my own patients.
Mm-hmm.
He came to me and he was 40 and he absolutely wanted to have testosterone, and I said, you know what, I just don't prescribe it. At that time we could do two different things. Clomiphene was one of those, and I said, I can do one of these two things for you and we can hook you up, because you never know. He goes, I'm done having children.
Yeah.
Life changes.
Sure does,
Sometimes
doesn't
you
it?
never know what's going to happen in life. And he goes, no. He goes, I'll go to another doctor. And I said, okay.
Yeah.
You know, I just can't do it. And he came back to me 5 years later with tears in his eyes, literally. His wife, 3 years before with the two kids, was killed in a train car accident. And he was lucky enough to find a second love of his life. Because, you know, most of us are only lucky enough to find one person that is the true love, and he found a second one, but she had no children. Mm-hmm. And until if he could guarantee he could initiate a pregnancy, then she would marry him. Otherwise, he wouldn't, because he went on and saw another doctor and took testosterone. So he had no sperm count, and we could not get it back because he had done it long enough. So honestly, she didn't marry him. And life went on for both of them. But I really do encourage younger men to find other things.
Right.
Clomiphene does help maintain fertility, and so there are many other ways that we can do to help patients.
Awesome. One of the recommendations that I've been making a lot, you can tell me if you have any experience with it, but we find that a lot of individuals, even in the great state of Florida, have low vitamin D, like extremely low levels. And so we found that men that will supplement with some vitamin D, some ashwagandha, and a little DHEA, we're seeing up to 25% boost in testosterone in younger men, just by supplementing those and adding the exercise component. So hard to tell which one it is, but they're working together really well, I guess, in our younger
Probably
men.
all of them. People don't realize that vitamin D, I know you know this, but everybody out there may not. Vitamin D is actually a hormone or prohormone. It's not really a vitamin. And when you use sunscreen, basically you stop almost all the vitamin D from being absorbed into your body, which is the main source of getting it. It's in a few foods, but not a lot. And so most people around here wear sunscreen, and they don't get a lot of vitamin D.
Yeah,
so
it's
vitamin
true.
D deficiency.
It's true. It's weird. You see me out in the parking lot here in the pharmacy, and I won't have my jacket on, and I just have my arms out like this, or in the morning, you know, I'll just go out and try to get some sun on my face, you know, to boost those levels. So, well, awesome. Next question is really around men who have taken that leap, right? Their doctors prescribe them testosterone, they're starting therapy. How do they really maximize the benefit of taking testosterone to live their best life? Any ideas there?
Well, the studies are really showing now that testosterone is probably the easiest and best called transdermally, meaning on the skin, as opposed to an injection, sub-Q or IM, meaning intramuscularly. When you give an injection, there's high and lows. When we have it compounded as a cream, men put it on the inner thigh or top of foot, and they get a much better absorption. It also helps prevent heart disease better if it is used as a cream. And men, of course, will love this one. They did a major study, and they showed testosterone as a cream helped with erectile dysfunction more than 80%.
Wow.
When it was used IM or subcutaneously, it only helped 53% of the time.
Awesome.
So big things, heart disease, ED. So of course now we're starting to use testosterone compounded as a cream almost exclusively.
Very good. And one of the benefits that I've seen really is these men are able to get back to the gym. They have the motivation, they have the energy to get back to the gym, and just seeing amazing transformations in a lot of our clients who've started testosterone. So.
Well, even the American Endocrinology Society now recommends that if a male is diagnosed with diabetes, that the first treatment they do, the first, if he is over the age of 50, is to start testosterone.
Wow, that's incredible.
So that's a big change in really what traditional medicine has looked at.
Oh, yeah, very good. Last thing on men's health. Let's talk about normal testosterone levels for your age versus optimal levels. So a lot of times our clients will go to their primary care doctor. They're having the symptoms of low T, but they get tested and they're at the lower end of normal. How important is it to be optimal versus normal?
It's important to be optimal for everything, no matter what you're talking about when it comes to hormones, and whether that's thyroid, whether it's testosterone or any other hormone. And hormones are best measured, meaning estrogen, progesterone, testosterone, DHEA, and the stress hormone cortisol are best measured with salivary testing. It is not a swab, you actually spit into a tube, but it gives us a much more accurate result. When you put testosterone on the skin, it basically goes into the tissues so quickly. They did a study, it only takes 12 minutes for it to go into the tissues. So it's really hard to find in the blood. So we do salivary testing. And first of all, what I recommend is salivary testing, because the blood testing may not be as accurate to really show us what that level is. But we do want people dead center of normal.
Absolutely. And you know, it's interesting you bring that up, because I have a lot of practitioners that call me with varying results, right? We make a great compounded product here. They'll say, hey, I just don't quite understand why the blood level is so low on this topical testosterone. So I'm glad that you brought that up. There's some inconsistencies when we test in the blood. So cool. Well, let's transition over to women. Okay. Women are a little bit more complicated when it comes to hormones.
I think they are in general anyway, and I don't say that lightly. I have 5 daughters, so I'll put it that way.
Absolutely. But you know, we know that women as they age, they want to look and feel their best, right? And so as they reach menopause or after menopause, we're getting a lot of curiosity now about bioidentical hormone replacement. Is it good for me? Is it safe for me? So with that said, one of the biggest concerns that I hear is the fear of taking bioidenticals, increasing the risk of cancer. Can you speak a little bit to those concerns that women might have?
Absolutely. In fact, my next book that comes out will be in October, and that book is How to Prevent Breast Cancer and How to Prevent a Reoccurrence. There's actually, if you use natural hormones, and let's define that for everybody.
Absolutely. Thank you.
So natural does not mean it comes from a plant. The compounded hormones do come from soy or yams, but that's not the definition of natural. Natural actually means the same chemical structure that you're born with.
Sure.
And then that way you really do have balance if you use the same chemical structure. So the studies on natural hormones, not synthetic, but natural hormones actually show a decrease in breast cancer risk. When you use synthetic, there's an increase in breast cancer risk. So it does matter if it's compounded, natural, bioidentical hormones. Absolutely. I actually have breast cancer on both sides of my family. On one side, I never even met my grandmother. On the other side, I had aunts, etc., who've gotten breast cancer. I use bioidentical hormones.
All right. And I went to your talk at Spring Congress, I think about a year ago. And if I remember my notes correctly, you've been in practice for about 30 years in the anti-aging personalized medicine space, right? And what were the number of instances of breast cancer that you guys had during those years of practice? It was extremely low, right?
None.
That was a shocking number.
In our offices in Michigan and Florida, over 30 years, we've had no patients with breast cancer, but the caveats to that are several. Number one, that we use only bioidentical hormones. When we give estrogen, it's always on the skin, and we use two different kinds of estrogens. There's actually three, E1, E2, and E3. We do not replace E1 because it's linked to breast cancer. E2 is the 400 functions of estrogen in the body, because for women, estrogen is literally 400 things. And then E3 is the estrogen that helps prevent breast cancer. So we have it compounded as E2 and E3 together and applied as a cream. Women are always very surprised to find out that there's an estrogen that helps prevent breast cancer. How long have we known this? The first article came out in JAMA 100 years ago.
Wow.
And so we've known this for a very long period of time. And so we like to use compounded, what we call bias E2 and E3, but it must balance with progesterone, not synthetic progestin, but the natural progesterone. It's honestly all about balance.
Absolutely. So just thinking that estrogen is responsible for 400 different functions within the body, just imagining a gal who is deficient in estrogen, right, or has little to no estrogen, they're not getting the benefit of those 400 reactions in the body, which have to at some point lead to disease and aging. Am I right?
Oh, it does. I mean, estrogen is taste, touch, smell, hearing, skin tone. It lowers cholesterol, blood sugar, blood pressure. Literally is your memory. I travel around the world and speak, and as you've said, my 15th book is about to come out. I will be 70 in July, and this is my natural color hair. It still is. A lot of this has to do with hormones because it really does keep all of those things functioning great.
Balance. Awesome. All right. The next one that I get a lot. Women who are 5 to 15 years post-menopause, they've been without hormones for quite some time, or at least adequate levels of them. Can they start bioidentical hormone replacement? And any caveats that you have along with it?
Absolutely. Now, the studies did show for brain protection and heart protection, it is best if you start hormones within 5 to 10 years of losing them. But that doesn't mean you can't start somebody who's 80 on hormones.
Okay.
It still has brain, heart protection. It still helps maintain your bone structure and all those other things. So the oldest patient I started on hormones that was a candidate for them, meaning didn't have breast cancer, as 93 years of age.
Wow.
She's still in my practice. She's 101, and honestly, she's so cute. She still drives, and she should, because I actually drove behind her, and she said to me the other day, she goes, "I think I now should stay off the freeway." So now she's not going to drive on the freeway, but 101, she still hikes and she still really gets around. She drives, she does a lot of things. She will herself will tell you it's due to her hormones.
Yeah, that's absolutely incredible. You have what seems to be one of the most amazing jobs in the world to be able to help people in this way. And super excited to continue to learn from you and be able to do those things here at Butterfields and help advise patients and other physicians as well. So thank you for all that you do there. Let's talk a little bit about postmenopausal women. They have trouble sleeping. They experience mood swings. This is quite common. What can we do to help them, or what do you look at to help these individuals?
There's a lot of reasons why people can't sleep, but honestly, that's why I went into this field. I was very, very happy being an ER doc in a level 1 trauma center in Detroit. I loved my job. I never thought I would change until one day I could not sleep. And so I went to 11 doctors. They all told me the same thing: take a sleeping pill. But I wanted to know the cause of the problem. Why could I one day not sleep when there was never a problem before? I was really lucky. I went to a conference that told me about hormones. And so I did the first saliva test in the Midwest and found out I had no progesterone at all. I started taking progesterone as a pill and slept really within 4 days.
Wow.
And hormones can take up to 90 days to work. For me, it worked right away, and honestly, for over 30 years, I have slept like a baby.
Yeah, that's awesome. That's awesome. All right, let's transition a little bit. We are going to talk about low-dose naltrexone, also known as LDN. This is probably one of the most popular and upcoming products I've seen over the past couple of years. I know it's been around for longer than that, right? But we're really just starting to see it pick up in popularity here on the east coast of Florida. So, I see a lot of patients using low-dose naltrexone as an anti-inflammatory. And I think the idea that I'm hearing from prescribers is trying to curb or prevent chronic diseases. Have you seen it used for that, and what is your opinion on it?
Well, it decreases inflammation.
Okay.
So first of all, naltrexone is Narcan. Narcan is what we use for a drug overdose at about 150 milligrams. But in low dose, meaning baby doses, we have it compounded to have the smaller dose. And then we use it for pain control, and it's anti-inflammatory. And really, honestly, almost every single disease you get after the age of 42 is inflammatory in nature, from all kinds of memory loss, not just Alzheimer's, to heart disease, to if you gain weight, that is absolutely positively an inflammatory condition, any autoimmune disease, and now there's a zillion autoimmune diseases. There's 108th, with the 107th being chronic Lyme, the 108th is long haul COVID, and so Hashimoto's and Crohn's disease and Parkinson's. So we use it actually for all of the autoimmune diseases. We use it for weight loss. We use it to prevent memory loss, treat memory loss. Heart disease, diabetes is an inflammatory condition. I take a small dose to help prevent breast cancer. A great study out of England showing breast cancer and prostate cancer are very inflammatory cancers. So we're now starting to use it for prevention of cancer.
That's
we
amazing.
also use it to decrease the inflammatory component in long haul COVID.
Absolutely.
Because with long haul COVID, that cytokine storm that you heard all about on television, radio, the internet is an inflammatory condition.
Well, thank you for sharing on that. I want to touch on the weight loss piece that you mentioned, because we are seeing an increased number of patients coming in and taking this medication for weight loss. And in my opinion, it's extremely affordable. They're having consistent results, right? Months after months. It's not a miracle pill, though some have called it that, right? From a weight loss perspective, but they're having steady weight loss over time. Is this something that you've used in your practice for weight loss?
Oh, absolutely. It definitely works for weight loss, but in order to lose weight, the big secret is slow. And that's how you keep it off. People that lose weight, I lost 30 pounds in 30 days. Well, that's great, but 98% of those people put the weight back on plus 5 to 10 pounds.
Absolutely.
So if you really do start an exercise program, you eat better, and you use things like low-dose naltrexone, have the rest of your hormones balanced, because testosterone for men regulates blood sugar, estrogen for women regulates blood sugar. A lot of people have weight gain due to blood sugar issues, and we got to decrease that inflammatory response. So low-dose naltrexone is part of a good weight loss program.
Awesome. Well, we're a huge fan. I think the conditions are just going to continue to unfold what we can use this for, and really excited about those who have taken that journey and started low-dose naltrexone. Well, this has been amazing. Thank you for coming down to Butterfields. Thank you for taking my telephone calls, around the different questions that we have regarding compounding and hormones and all that you do and teach. Last question for you, how important is it for patients to have a good compounding pharmacy that they can trust the quality of the product and know the pharmacist they're working with?
It's really important that you have a fabulous pharmacist, and I believe in something that we call the sacred triad. It's the patient, the pharmacist, and the prescriber. We all work together, and when we work together, the patient then has an easier time with optimal health. For those of you who want references to what we've been talking about today, my book, What You Must Know About Women's Hormones, will actually give you, you have a copy there, okay? We'll give you, this is the second edition, we'll give you a lot of references and really a good explanation for women. And then my book, Maximize Your Male Hormones, will give you a good idea on male hormones. And they both mention low-dose naltrexone because it is a component of keeping healthy.
That's awesome. And we've got copies of the book down here. What You Must Know About Women's Hormones. We've got several copies, so come on down and get your own free copy today while supplies last. Well, Dr. Smith, it's been a pleasure.
Oh, my
really
pleasure,
appreciate
truly.
you. And everybody watching at home, thank you for tuning in today. Have a great day.
Thank you very much.
Bye-bye now.